Welcome to Holy Health, the podcast where cutting-edge health insights meet timeless biblical wisdom. Join us as we explore the latest in wellness, fitness, and mental health, all while grounding our journey in the spiritual truths and guidance found in the Torah. Whether you're looking to nourish your body, mind, or soul, we'll help you live a life of balance, vitality, and faith. Tune in to discover how to achieve holistic health through the perfect blend of modern science and ancient wisdom. Let's dive into the fullness of life, body, and spirit together. Welcome back to Holy Health. I am so excited to bring you guys this week's episode. You will hear time and time again throughout this episode about this being a passion topic of mine. And I just felt like I needed to put this episode out on this particular Thursday because, God willing, my daughter is getting married today. When you guys hear this, will be the day my daughter's getting married. And there was just something so special about putting this out with three really special women and having it come out on the day of my daughter's wedding that I really wanted to make it happen. So a couple of little notes. Number one, you'll see that the Torah extras were actually recorded from my office with a phone. Usually I record from right here inside the Closet Podcast Studio, but I needed to do it. You'll hear why, because it was 4 days before the wedding and the dress that I had didn't work out. And I'm sure most of you women who are listening can totally get why I needed to leave work, get this episode done, and then get on to being able to find a dress. And you guys will be all happy to hear that. Thank God, Baruch Hashem, I did find a dress. So with that, for some reason, the episode or the piece of the Torah Extra with Nomi seems to be that we recorded where Nomi is on top of me and I'm on the bottom. I'm not quite sure why Riverside did that, but if it comes out a little bit funny on YouTube, I apologize, but it's really Nomi's information that you need to hear. So I want to tell you guys a little bit about my guests. Three very, very special women. My main guest is Dr. Helen Porat. She and I met on Instagram at the beginning of COVID. And Dr. Porat is a former competitive gymnast and an all-star cheerleader turned coach and later doctor of physical therapy. From an early age, she watched her mother battle chronic nerve pain and CRPS, and she knew she wanted to be a healer. To say she's been fascinated about how to heal the nervous system, her mother's chronic pain condition, and all of her broken gymnast cheerleader ailments is an understatement. This sparked her passion for medical movement, which led her to receive a kinesiology degree from the San Diego State University. There, she was vice president of the Physical Therapy Club and continued coaching all-star cheerleading. She started her career in physical therapy after completing her doctorate from the University of St. Augustine for Health Sciences in 2009. She combined biomechanics, scientific research, and evidence-based practice with manual therapy, and she felt the stars aligned for her lifelong yearning to gain a deeper and comprehensive understanding of the body and tissue healing. She completed their postdoctorate program and became manual therapy certified, and then worked as an adjunct faculty for the University of St. Augustine. For over a decade, she's been able to realize her passion for healing the body through assessment of the nervous system, movement, and manual therapy. She empowers her patients through their healing process to learn how to make their bodies more resilient and less vulnerable to injury. So Nomi Levy, who is, I believe, up first with our Torah Extra, is someone you guys have heard from before. Many of you know her. And Nomi is a board-certified nutritionist and health coach affiliated with Duke Integrative Medicine. She also holds a Master of Science in Nutrition and Functional Medicine, and she has extensive clinical experience. She loves nutrition so much that she's currently pursuing her doctorate in clinical nutrition. She loves learning so that she can provide her clients with the best information and support. Now, Liora Rosenblatt is someone new. We met not too long ago through Instagram, and I hope this will be the first of many times she appears with us as well. Liora is the founder and CEO of Sophia.org, which is a new deep Torah content website for women. Liora is originally from Montreal, Canada, and made Aliyah to Jerusalem. She has extensive writing, PR, and project management experience, and she has a very deep passion for Torah. The women's role and place in Judaism has always been close to her heart, leading her to establish Sophia, a platform dedicated to today's Orthodox Jewish woman. So as I said before, these are three very special women. I just feel, there's a word I'm looking for that's not coming to me right now. It's kind of late at night for me. And as you guys can imagine, there's a lot going on this week. But really, I just wanted to get this episode out to you. This literally, if everything else you guys have heard me talk about, you're doing, but you're still not feeling great, you may want to consider that breathing might be a piece of the key. So tune into this episode, listen to what Helen has to say. We're really more of a little bit more of a conversation than just an interview, because we are like soul sisters when it comes to this topic. And then hear how the Torah puts this information together. This is like one of these things that it is so basic that literally you can find breathing in Torah. Sometimes we have to go at our topics in a sort of roundabout way. This is to Torah like this is, but breathing is there. And as I said with one of these women, there is so much more to say than what could be said in the 15 minutes. So this episode is a little bit longer. It's probably going to be about an hour and 20 minutes, a little bit longer than my usual, but I hope you enjoy it. There will be links to all of these women in the show notes, as well as a link to the Shtender that I talk about that will hold your head and neck in alignment. Dr. Shtaygen, created by my brother Shlomo. There'll be links to that as well. And I may put his Instagram there or his YouTube as well. So check all of these things out. Please keep your topics coming. We have so many new topics, so many interviews coming up with really, really interesting topics. And I continue to seek out new Torah experts. And again, it makes it sound like you have to be an expert. All you have to do to come on Holy Health and talk about Torah is love Torah and be able to make some good connections. So I'm wishing you all a Shabbat Shalom. And I'll hopefully see you back here in 2 weeks. Hey everyone, I am so excited to have my friend Helen with us today. Helen is one of these people that we met literally right at the beginning of COVID on Instagram, right when I got into Instagram. We immediately bonded. Whether it's the fact that she's not Israeli, but she's Jewish, she's Sephardic. And, so we bonded kind of over Israel, and we bonded because what we're going to talk about today is something that she and I are both incredibly passionate about. So if this comes across today more like a conversation between two friends, you'll understand why, because we kind of keep finishing each other's sentences a little bit, as this is a subject we're so passionate about. So first off, we're going to be talking today about breathing and nervous system regulation. It's something that both of us think are so important. And Helen, I just want to welcome you. Thank you so much for coming on today. I'm so
Thank you
excited.
so much for having me. It's always so much fun talking. And like you said, we kind of somehow immediately just share brains. So this is going to be a lot of fun.
Absolutely. Okay, so if we're going to be talking about breathing and nervous system regulation, can you talk to me a little bit about the nervous system? What is the nervous system? What are we really talking about? And how does breathing
Yeah.
fit in?
Yeah, absolutely. So right now we're hearing, and did we ever think that 5 years later, everybody would be talking about nervous system the way that they are now?
It's so
So
true.
this is really exciting times for you and I. But when we're talking about the nervous system, we're talking about the autonomic nervous system. So this is a system that works to keep our brain and body surviving, right? Our survival subconscious system. So this is keeping our heart rate, our digestion, our brain, everything that's happening under the hood is happening through our autonomic nervous system. And what we are now understanding, and I love that more people are starting to understand this, is that we've always known that the system is supposed to work together harmoniously. Our sympathetic branch, which is our fight or flight, our stress response, and our parasympathetic, this is that oasis, our healing center, rest and digest. It's supposed to work harmoniously, kind of like a yin and yang, working together. Now, these two systems can't be on at the same time. So when sympathetic drives in, so this is our fight or flight, this is slamming on the brakes, experiencing frustration, maybe some of the stresses that you and I have even gone through today, right? That sympathetic response, that's good, that's stress. Stress isn't bad, it happens. Once that event is over, the appropriate response would be to wipe out the sympathetic response in your body and then have this lovely natural parasympathetic rest and digest rebound. Okay. And so what we're seeing right now is that we're just not getting that rebound. It's just nowhere to be found. And so we're staying in this chronic fight or flight state. And maybe because you and I are physical therapists, someone is coming in because of back pain. Maybe they're coming in, pain equals inflammation. Inflammation comes when we're in that sympathetic state, right? And so we could just almost think of it as our inflammation faucet. And if we stay in that state for too long, we said stress isn't bad, but it depends on the amount of stress that you have, how long you're in stress, and your skills and tolerance to it, that ability. So maybe some of those skills are the ability to get that parasympathetic rebound, to digest some of it. So when it comes to breathing, okay, hopefully I've cued everyone in what we're missing, which we're missing that parasympathetic rebound. Breathing is a direct, fast track highway to that parasympathetic response. So if we're under the impression that most of our patients, most of our experiences, and hello, if we've been in stress for the last, I don't know how many years, COVID, war, all of these things, hello, we need some parasympathetic in our life because that sympathetic dominance is high and hypervigilant. Our breathing is going to be a gateway really to starting to get that parasympathetic rebound through the vagus nerve.
Okay, so tell me what kind of breathing you're talking about. Are we talking open mouth? We talking nose? What are we talking about here?
And I wish you guys could see Dara's face because she's already smiling because she already knows. We talk about this all the time. Okay, so we are talking, and I know everyone gets a little heightened when we talk about this. We are talking about nasal breathing. And I know people are already, I feel the frustration. They're like, I can't breathe through my nose. I have a deviated septum. I've never been able to breathe through my nose. But really, the gold standard to activate your diaphragm, which everyone right now, put your hands on your lower ribs. Okay, your diaphragm sits right there on the lower rib cage. It's nasal breathing. Nasal breathing is going to be the fastest way to contract the diaphragm. Okay, when you are nasal breathing, your tongue is going to be on the roof of your mouth, flush on the palate of your mouth, not too pokey. This is going to create neck and head stability. So your tongue position, your tongue posture. Did anyone listening to this podcast ever think that they were going to have to worry about tongue posture on top of all the other postures? Okay, but you know, that's going to keep us in the correct posture for breathing. And then you can take a big nasal breath, and it's going to help contract the diaphragm. So in our gold standard breathing, we inhale and that diaphragm contracts, and it sits right on top of our organs like a big parachute on top of our abdomen, on top of all of these very important pipelines in our gut, lymphatic vessels. And then the hammock is our pelvic floor. And so with the diaphragm and the pelvic floor, they should work together, contracting on that inhale, the pelvic floor relaxes, and then on the exhale, everything comes back into a resting state. So that is the gold standard that we're all trying to achieve. Now, what's really happening to most of your patients, Dara? Do you see
Yes.
that?
So I have, like, by the way, for everything we're going to talk about today, I probably have a good story, and I bet you have a good story as well. So for all the people who are exactly like you said, I can't breathe through my nose, and I have a deviated septum, and I have this, I say it like this. It's like anything. The more you practice it, the better you're going to get. And so I have stories of a couple people. Like I have my one most interesting one is I had one woman who, when she first came in, she's a woman who I think she was 69 when she first came, and she had to turn her head slightly left because
Mm,
she couldn't breathe through one of her nostrils. And a few months later, she realized she no longer needed to turn her head anymore. She could now
isn't that
breathe through
amazing?
both nostrils, something she hadn't been able to do in many, many years. Yeah. So
It's
that's just
amazing
one
how
offer.
many changes can happen. Yeah. And that's so encouraging too, that really, craniofacial structures, like we have the ability to change.
Yeah.
Before I get too carried away, I do want to add that there was even a study on mild sleep apnea
Mm.
and some mouth taping and so
I
nose
was
breathing. Did you see that too? Okay, of
no,
course
I
you
was
did.
going to ask you, how do you suggest mouth taping to your patients? I was going to ask you that. Okay.
Yeah, yeah.
Yeah.
So yeah, we can talk about all of that. Yeah.
Oh, yo, keep good. Talk about the study. I didn't mean to cut you off. It's my
Yeah, yeah.
ADHD.
Yeah, so with mouth taping, so I think that they took these. participants, and they had mild sleep apnea, which, right, everyone gets anxiety at the idea of not breathing through your mouth or having air hunger. And it actually showed that with that nasal breathing and, via this mouth taping technique, ended up improving their sleep apnea, right? And so now we can really get into the posture, the tongue position, what you're doing every time you take a nasal breath, right? This is getting nitric oxide to vasodilate. That means that it's making pipes bigger in your body. And so at a chemical level, Dara and I can talk about this forever, it's actually creating space. Okay. And when you have more space, not only are you having more space in that airway, but you're having more oxygen delivery. You're having more, of our nutrients, right? We're talking about the healing center, right? So now just imagine like little packages. We're just getting more of those packages every time you successfully take a good nasal diaphragmatic breath.
Okay, so let me ask you a question. What might you see in somebody with a dysfunctional breathing pattern, and what might be some of the complaints that people would come in with? And I know this is a long list,
Mhm. Yeah, definitely. So
just to
let's
give
paint a
people an
few
idea.
pictures, and I'm sure that you've seen the same thing. So, as physical therapists, people are coming in to see us because they are in physical pain, right? So, just pick a body part and I can go there. But let me just paint a picture of maybe what's happening when you're not nasal breathing. And what's happening when you're not nasal breathing is that your head, in order to accomplish successfully taking a breath in, has to be a little bit forward. And so you get this forward head, then the mouth opens, and they're taking breaths through their mouth. It's probably short, and they're using their neck and chest. So just even without painting the full picture, just knowing that this person is mouth breathing, not breathing through their diaphragm, even just looking at the upper part of our body, we're talking about headaches, okay? We're not getting oxygen delivery. We're cutting flow to major nerves and pathway. That vagus nerve that I've talked about, that everyone's talking about, you're literally squeezing and constricting it every time you take a breath through your neck and chest. Okay. And so we're talking about major headaches. Maybe you even have this patient that has nerve pain, right? We have our big chunk of trees, that brachial plexus that sits right between the scalenes before it goes down through the collarbone. So we can talk about the nerves being lit up. So that could be, the headache, jaw, neck tension patient. And then of course, what you and I see all the time, which is our spine patients, and this can be young, old. When you aren't diaphragm breathing, you're missing a huge part of your core contraction. Okay. And so we can talk about this just from an orthopedic standpoint, that your muscles are not turning on and off the way that you're supposed to. And so you're bracing with thoracolumbar fascia, with your psoas muscles. You're just creating this hard brace, which might be strong in some situations, but it's not very resilient and doesn't have the ability to change directions. You become very vulnerable to insults. So this is happening even to our strongest of our strongest patients. So that's just the physical component. Let me just chime in here because this is what I'm passionate about. That what about our emotional component and being in a chronic state of fight or flight?
Hmm.
Okay, just even saying chronic state of fight or flight, that means that your inflammation faucet is never turning off. So if you have an inflammation faucet that's never turning off, that means pain is high. So when we talk about the title of today, which is, what did we decide? Breathe to heal. We're
Yes.
talking about how do we successfully get rid of inflammation in the body. So we talked about the physical component, what it might look like posturally for this patient, but let's talk about what's really, because we could give them the best exercises. Let's
Yep.
talk about what's going on under the hood in that brain body communication with that inflammation faucet on way too high. So yeah, that just kind of, I know that you probably have 100 patients that you're thinking about right now.
Oh, yeah, listen, that too. And also, exactly just to add on with what you're saying, we kind of, let's say before we got on, talked a little bit about this, that, I tell people all the time, if you look around, most of my patients are young, athletic, training for the army, or they are athletes. And if exercise is meant to just protect us, clearly there's something wrong, because if exercise was meant to protect us, these young athletic people training, doing exercise at such a high level, they shouldn't have pain. But if they're having pain, there's a reason why. And I explain it that there's a difference between strength and stability. And very, very often they could be very strong in some of these muscles, but they actually don't know how to turn them on to make them stabilizers. If we're talking about the core, which encompasses a lot of different things. And they have to learn the difference between strength and stability so that they can understand how to bring stability first and then create a great, strong body around that stable surface. And exactly like you said, people who have pelvic floor problems, people with a lot of gut issues, stomach issues, all of these hernias, um, heartburn, all of these things, constipation, all of these things can be treated through learning how to breathe. And I know you know that as well. You just were starting at the top. So,
We got to start somewhere. Yeah, absolutely. And I think it's just also so empowering, even talking about the first part of our nervous system, 101 here, that just understanding and just having this maybe newfound awareness of the fact that our body tends to be prone, especially 2025, we tend to be prone to a lot of that sympathetic dominance, right? And so this could even be for the person that never really felt anxious before. A lot of these open faucets are happening under the hood. So hopefully this can be empowering to just understand how you can start bringing in a little bit more of this healing center into your daily life without having to know all of this. I know you and I, especially I can get really carried away with some of these, really interesting mechanics and chemistry that's happening in our body. But just to understand that even just a minute or even maybe some of the postures that we'll go over today could really be a starting point to changing the balance and the harmony in your nervous system right now.
yeah, that's excellent. That's really good. So, how would you someone comes into you, describe any patient you want, maybe someone you saw yet, well, it's very early Monday morning by you, so you didn't see anyone today, but I see we both have our dogs near us. uh,
We do.
but
You can
maybe
hear
some
panting. That's not me. That's Everest.
maybe a patient that you saw last week. Somebody comes in first visit. What are you getting them to do? Because I know every patient's different, and some people get things quicker, and some people it takes a little bit longer. Everybody gets it in the end, but we have to meet everybody's body where they're at. So, what are you kind of doing in terms of teaching them how to breathe in that first session?
I think number one, and this isn't the ideal posture, but I think the number one way that I feel successful in getting someone to relax into diaphragmatic breathing is some kind of a child's pose or modified child's pose, right? Even if their arms aren't all the way up. And the reason why I do this is because I feel like many people are working against these protective patterns that we kind of talked about with the neck and chest, with maybe not being able to get the head position perfectly because they might have actual joint restrictions and fascial restrictions. And this is where it can be really frustrating. So when I get people into a child's pose position, their forehead is rested. So that means hopefully they can get some kind of rest through their neck. And then their knees are all the way up to their chest, which means hopefully they're not able to use their hip flexor, their muscle as a different strategy. And so what I'm trying to do in this position is isolate the diaphragm. So I'm trying to bring some deep awareness to a muscle that again doesn't have a lot of real estate up in our motor cortex brain. So I'm trying to build that proprioception, that feeling of the diaphragm contraction. So that would be probably the first way that I would even just bring awareness, because that can feel really icky when you don't know how to do it. And when we're standing and I tell you, and even right now I can tell you, a gold standard posture of, tongue up to the roof of your mouth, get your head over your shoulders, get the shoulders over the diaphragm over the pelvic floor. We're already working against a lot of muscle restrictions and muscle imbalances to do that. So it can be quite frustrating, and it can feel like you're breathing into a tight area that might even cause you more anxiety. Right. And so it's almost like you're kind of stuck in saran wrap and someone's like, okay, now breathe. So I find that child's pose can be a really good start for just understanding where the diaphragm is and getting rid of some of this bracing in the abdomen. Okay. I don't like cueing people on belly breathing, but the intestines are supposed to relax on the inhale. So initially, it almost feels like this paradoxical movement because I ask a lot from you. I ask you to inhale to contract the diaphragm, which means either a lateral expansion in the ribs, right? If you have your fingers on your lower ribs right now, or I ask you to do an anterior where your hand is placed right above right above your tummy there. And so I'm asking a lot because I'm asking you to contract it, but at the same time, I'm asking you to relax your intestines and your pelvic floor. So this is like kind of high level stuff. So yeah, definitely give me feedback on what you think about this child's pose if you've ever tried that.
So I think it's excellent, and I just want to point out that it just goes to show that you can. What's that expression? There are many ways to kill a cat. I don't know. It
Yep.
sounds
Yep.
horrible. Whatever that expression is, because I usually start people on their back, feet up on a chair, knees a little bit closer to their chest. So sort of, it could almost be considered like a child pose on your back, because I do usually have the knees more than 90 degrees, a little bit closer to the chest for that same reason, relaxing so as, you know what I mean, or shortening it. And often, if they cannot keep their neck long and their chin tucked, then I might have to like roll up a towel or roll up a mat and slightly put it under their head to lengthen and try to give them a little bit of a chin tuck. And so I think that obviously it is clear as day to me that both can work. There's not one right answer because you probably do it the way you learned or the way you found works for most
No,
people.
what's funny
I've
is
done it the
that
way
we're doing the same thing, right? And
right,
then what I would do with my patient, the second level would be to start working on the head and neck position, right? As part of the
right,
picture. And so I love this is where we share brain. We're literally right. We have the same idea. Like get
right.
those knees flexed, get this, muscle to contract, and then you're already thinking about the really good head and neck posture that that patient has to be in to be successful. That's great.
Yeah, and one of the things I notice, one of the things I usually tend to tell people also is that if you think about what people do when they're stressed, they tend to hold their breath, clench their jaw, and squeeze their butt and tighten their abs, like literally clench every single thing in their body. And that is exactly the opposite of what should be going on when you are diaphragmatically breathing. So, meaning when they can get this awareness, so if people can develop this awareness to notice when they're like clenching everything, you're able now, whereas in the past you would have just gone on clenching all day long. Now you're able to say, wait a second, stop. Let me try to just do a couple of breaths, no matter what position I'm in. Doesn't even matter if the breaths don't come out diaphragmatic, but you've actually unclenched everything. So now you've created, you're training your body to the fact that breathing is really important, even if it's not coming out 100% right on day one, but also just to like get out of that completely clenched posture that's doing the opposite of what breathing should do, which is relax you.
I
So,
love that you painted that picture because, right, what we're trying to do today is build awareness. And, what kind of a patient would want to learn about breathing? Hopefully, someone who is just ready to make some changes, who feels like there's something missing in their body. And I love that you talked about unclenching because what we're really talking about is changing the feedback loop in your brain, in the deep part of your brain. You're trying to change the way that your brain and body communicate, and you're trying to change that perceived level of threat. And so if you're walking around, driving around, doing around, whatever you're doing, in a clenched position, squeezing, right, the chicken or the egg, you now are telling your brain from the bottom up that there is perceived threat. Okay, so you're walking around in an anxious, already survival mode with a perceived threat. So maybe you've gotten this way because you've been at a forward desk posture. We've been students our whole life. We do a lot of sitting. Now we're on our phones a lot. So maybe it's that, or maybe you actually had a traumatic event or an event that you had to adapt and survive. And although the event is over, your body has stayed in that same hypervigilant bracing position. And so what we're doing now, even by bringing some gentle, loving awareness to that clenching, you're starting to rewire and break those protective patterns and feedback loops. So unclenching, number one, right? Relax the booty, relax your pelvic floor, relax your tummy. Then bonus points. Now we just start to introduce breath. We start to get curious about our own patterns. Okay. Are we breathing through the neck and shoulders? One pattern that I find a lot of young women are bracing their tummy because we've always been taught to suck your tummy in, get those, tummy tight. Even the way that we worked out made it so that we built a lot of thick fascia on our outer abdominal muscles. And so this is really hard when we talk about that second, level of understanding how to contract, but then relax the abdomen. And so what I'm seeing is that these poor ladies are like, oh, I follow Dara, I follow Helen, and they told me to breathe. But now every single time they breathe, they're actually contracting and constricting vagus nerve. So it's this paradoxical movement. So I feel like that's why you and I are so passionate about just giving people little tips and tricks to get it right.
Yeah, 100%. So let's talk about that, right? Because I can tell you what I've noticed. And I think, and maybe at the very end, we'll kind of sum everything up to make sure that we put it into a package that's very understandable for people. But you brought up a really good point. If people are clenching their stomach, this is what I find. I do not need to get every single person who walks through the door to release their abdominal muscles, but there's a percentage of people that literally you have to, if I don't start to manually release, and then I usually get them to lay on like a medicine ball or something like that to try to do self release of the abdominal muscles. But if you literally don't manually release them, breathing will get them to lengthen, but it will take a heck of a lot longer. If I go in
Yes.
there and I hurt you a little bit and I manually release, and you can talk about the diaphragm and manually releasing diaphragm, it will just take a lot longer. It will be much quicker if we actually can get the abdomen to relax. And then if you continue to work on your breathing, you'll keep it relaxed and it won't keep coming back. So that's something that, again, I don't know if you see a lot of that, where especially people who are high level athletic exercisers that do tons of core work, yet they still have back pain, very, very often their abdominal muscles need to be released because they actually do not know how to lengthen these muscles at all.
Right. Yeah, and this is a problem because then you ask to breathe and it's like working, treading water. You're not really
Right.
getting anywhere with it. And so absolutely those fascial restrictions and the power of someone releasing for you, and how I teach my clients online that I'm unable to put my hands on, the power of releasing yourself, right? Because
Mm-hmm.
what we're doing is not only successfully changing mechanics, when you start releasing all of those deep fascial areas that have just been bracing and holding tight for so long, but you're creating safety within your own body, and you're actually changing, just that overall sensation of being able to expand and get more proprioception through that area. Definitely. Yeah, and this area just gets so bound down. Now we talked about how forward posture, right? Everyone can just lean forward, and you can see how it's almost scrunched up like an accordion down in your abdomen,
Mm-hmm.
right? And so if we're like this most of the day, then we're probably not getting successful breathing happening. And then the other part is when your deep part of your brain has been under threat, right? We're talking about predicting protective patterns through the limbic system, through the amygdala. Okay, psychotherapists call this like the amygdala hijack. You actually have a nerve pathway connected to your breathing muscle that makes it constricted, right? We talked about running from a bear, all of that bracing. So now your brain is telling your fascia to hold constricted. Your posture is reinforcing this constricted motion. So this is why I really love to work on both ends, right? Having this deep awareness, rewiring of that threat response, making it a more discerning sympathetic output so that it's not so excitable, and then working the body and creating safety through the body. And what that does when the brain stuff doesn't work anymore is it actually alleviates your brain. And you're actually creating neural pathways, which means that your brain and body can start breaking up those protective patterns and communicating differently. So what that means for your young guy, for my patient, for my busy, overwhelmed mom, is that all of a sudden they're in the same stressful situation, but their brain and body start responding to it better. All of a sudden their back doesn't go out every single time something happens in their life.
Yeah, and I think you brought up a really important point that I want to reinforce. Helen talked about the fact that whether it's you're sitting too much, you're sitting in this forward head posture, I want to point out because it's important because of the people that listen to Holy Health Podcast. It does not matter if you are an executive sitting at a computer or you are a yeshiva student studying in yeshiva. It is the same forward head position. And I'm going to put a link at the end of this podcast to something that I think I've shown you before, but it's actually a stand created specifically for learning that keeps your head and neck in alignment and brings the book up to your face. And this is an important tool, and it happens to be that it was created by my brother with no input from me.
I
He
didn't know
created it. It was
that.
done being created, and I looked at it and I'm like, you've got to be kidding me. This is what I'm teaching every single one of my patients. And with that being said, one of the reasons I think, and you can chime in if you believe this or not, that there are so many 15, 16, 17, 18, 19 young people with so much anxiety today is because in our day, well, I'm a lot older than you. She couldn't necessarily be my child, but she could be my very, very early love child. If I, had a baby when I was 16. Um, but kids, what are they doing? They're looking down all day long at their phone. And that is the position that Helen's talking about. So we could have the best intentions. We could teach you guys all of this. My patients know that I'm insane about this. If you don't start holding your elbows on your side and holding literally your phone like this, the phone up to your face, if you're watching on YouTube, you can see this keeps your head and neck in the alignment it should be in. If you're going to continue to look down at your phone all day long, you're going to throw off all this good stuff. The 10 minutes of exercise you do in the morning is not going to overcome 3 hours of sitting with your head down looking at your phone. So I just had to chime in with that
Well,
because
no,
you were
because
already
this
talking
is
about
this
that.
is what it takes to heal. And what it takes to heal is having awareness.
Yes.
And so where can you find a little bit more healing? Is it that now we're starting to understand that posture changes your breath, that posture changes, or that the breath, the way that you're breathing changes the way that you hold your fascia, the way that you hold your fascia maybe tells your brain that you're in a state of survival, right? Or we can do that all backwards, right? State of
Right.
survival makes you do that,
Right.
right? Da 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 da. Okay. And so
Chicken
now
or
we're
rice.
having awareness. What do we
Right.
do? Okay. Insert change posture. Start playing around with that tongue position that Dara and Helen are talking about and figuring out if I can breathe through my nose, right? Maybe learning some of these releases. Okay, so it all starts with having awareness and starting to understand your unique experience and trying to change it. Like you said, it's not just the 20 minutes in the morning or the 30-minute workout. It's really these movement snacks, these
Yes.
micro shifts that end up making big changes in the long run.
A
Yeah.
100%. You said that beautifully. 100%. So let me ask you, I know some of your Instagram followers, I know people have questions. Are there some questions, that some people were asking you that maybe you could answer, I could answer, we could answer together?
Yeah,
Rather
so
than
I
just
think
I know, let's hear the questions from the audience.
yeah, so I think one of them that you had responded to this morning
Mm.
was someone had said that like that, like now, right? Like you and I have the best of intentions and we're kind of encouraging people to get curious about their breath. But this person, every time that she tries to breathe, it actually produces more anxiety in her body. Okay. So do you want to chime in? Do you want me to?
So I'll tell you
We've
what
talked
I
about this a
answered
little
Helen.
bit.
Yeah, I'll talk about this a little and then I'll let Helen talk about it as well. Because I happen to be that there are very few stories that I actually watch, but I look at Helen's and I look at one or two other people's. And so I happened to look at her stories this morning and I saw that somebody had made that point or asked that question or made that point. And I said to Helen exactly like I knew she would say back to me and I tell my patients this all the time also, people that have chronic back pain or who are chronically stressed or anxiety, if we didn't make clear enough that breathing may not solve all mental health problems, but if you do not retrain your breathing, you're going to struggle for much more and much longer with your mental health problems, okay? Because you do need to access, the parasympathetic nervous system. But that, so what happens is people get told to meditate. Well, guess what? If you hate meditating, you probably are not tapping into the parasympathetic nervous system because you can tell someone to breathe or to meditate because you know it's good for you, but many people need to be taught how to do it in a way. And sometimes, like we both spoke about, you've got to release the diaphragm, you've got to release the abs. Like sometimes that's why it's much better to come to someone like Helen or come to someone like me. And we'll talk about Helen has an online course as well, we can talk about later. To get a few sessions and to learn, because otherwise it will produce more anxiety because you're not getting the parasympathetic benefits, because for whatever reason you may need kinesthetic feedback, you may just need some help in learning how to do it. So that was kind of what I answered for her, as I knew she would say herself on her Instagram story.
Yes, like I said, we share brains, so I love that we can do that. But yeah, this is really why I became passionate about having the diaphragm muscle be a pillar in my brain body breath course. So my brain body breath course is to get rid of chronic pain and stress. A lot of people coming into this course with trying to find autoimmune diagnosis, chronic illness, some people just curious about the back pain that won't resolve. But really, if you are attempting to breathe deeper and lower and slower, like we encourage our patients, and then you're having more anxiety, I would suspect that every time this person takes an inhale, they are constricting somewhere. So, what I've seen is when I observe people's breathing postures, which is what I do virtually and in person, it literally looks like their neck is choking them. When you observe the muscles, and you could even put your hand on the front of your neck muscles and take an inhale. And when you're unable, fascial restrictions, like you said, maybe just understanding where the diaphragm is, literally looks like they're choking themselves every time they take a deep inhale. No wonder that's anxiety driven, right? Or just tightening through the chest and neck, or the slower and the lower they try to get that inhale, the more their abdominal muscles contract. Oh my gosh, can I find the word? Okay, and so yes, absolutely, just from a mechanical standpoint, right? Whenever we talk about breathing, I try to stay on track, but we're talking about mechanics, the way that we move. But then let's talk about the chemical change. When you're not taking a successful breath, the chemistry in your body actually changes. Okay. And so you are becoming carbon dioxide intolerant. That means that for every breath, you are not getting a maximum oxygen delivery to your tissues and to your brain. So this can feel like air hunger. This can feel like an actual induced anxiety, right? Just imagine you're running, you're scared. And so every time you take a breath, you might be reinforcing those patterns. Yeah.
Well done. I agree.
Yeah. So hopefully what I would tell this person right now is, yeah, to keep learning, to take my course, to go see Dara, to go, right. Like we need to change. And this is why I'm so passionate about unlocking and waking up people's ability to use their diaphragm. And it doesn't just have to do with the diaphragm. It doesn't just have to do with fascial restrictions there, because if your neck and chest are stuck, which is why I teach self releases and I do manual releases, right? That vagus nerve exits right behind the ear to the front of the neck. We need to get flow everywhere. So this can be like we were talking about before, insert awareness of clenching, insert awareness of posture, maybe getting curious about nose breathing, maybe seeing if you can relax your pelvic floor, your abdomen on those inhales. So always ways to improve and make micro shifts, right? We don't expect anybody.
100%.
I, by no means, I am not perfect at breathing. I have to work on it. These are practices that I've implemented for myself as well, right? So it's a practice for sure.
Yeah, 100%. 100%. Do you have some other questions from some people who may have posed questions to you? Because if not, I have
Tell,
more
tell,
questions as well. And
yeah, we can definitely ask more questions. I find this one comes up just because of the world that I'm in on Instagram.
okay,
Um, and there are a lot of people that are tying in and starting to understand that there's an emotional component to their body. Okay. And so there's a lot of, first of all, I don't care if it's good stuff or bad stuff. If it works for you, two thumbs up, right? Like I
me
really,
too.
I could care less if it's said the wrong way. Not scientifically perfect, but
Yep.
guess what? It works for you. Amazing. We could only hope to find things that work and give you a little bit of a linchpin in your healing process. But I don't know if you've come across this a lot, but people are tying in emotions, feeling emotions in your fascia, feeling emotionals in deep part, or and you might have had patients. Oh, every single time my in-law comes into town, I start to get this left shoulder neck pain, right? And
Yep.
so what is this? And how can we describe this in a way that's empowering, accurate, and can maybe help somebody improve? And so the question from someone said, where are common areas that emotions are held in our body?
Good question.
Okay. Yeah. So first of all, we can talk about what emotions are there for our brain and body. Our brain and body is wired for survival. It is not wired for happiness or blissfulness. It is wired to keep you going. And so, with that being said, it's going to register any really strong emotions. Okay, so anything that is heightened is going to register as maybe I have to pay more attention to it. And so, what does that mean on your body standpoint? I think you painted a really good picture of this. This means that your body is clenched, ready to fight, ready to take something on. So, now we're talking about experiencing an emotion that might not be actual threat, but then our body is preparing for that fight or flight response. Okay. So now we can understand why some of these areas in our body might be more susceptible to emotions. And what I find, right, our fascia is such a fascinating subject. I think we should have a whole podcast on just fascia, but our fascia now is going to respond to an emotion, right? And so this is where people say, well, is it stored in my body? I don't care what you call it, but it's going to respond to strong feelings. And that person is going to have a clenched diaphragm, like we talked about, bound down in their lower ribs. Their psoas muscle, these hip flexors that lie on the front of the abdomen, are probably going to go rigid and tight, right? Because they're getting you ready to run, because they are getting you ready for fight or flight. So this is how I describe it to my patients, that the deepest parts of our fascia on our spine, from our tongue all the way down to our pelvic floor, all the way down to the bottom of their foot, might have the tendency to be shortened and tight because of a protective pattern. And I really like to get curious about using the words. Again, words don't matter, because if it helps you a different way, then do it a different way. But the way that my brain works to understand and try to dissolve it even further than just this emotional experience is to really break the protective pattern. So when you have the awareness of how emotions can impact the deepest part of your fascia to make it tighter, you have the empowerment that, ooh, guess what? Breathing actually acts as a muscle relaxer, better than a Tylenol, better than any, muscle relaxer, anti-inflammatory on the market. And then you start using this. What are you doing? You're breaking up deep protective patterns that you might have even inherited in your DNA, right? This isn't even you've had to have a traumatic experience. This could be inherited genetic trauma, all of that. So that's the way that I like to approach emotions and fascia. I don't know if you have a different way to look at it.
You know what? It's different, but it's similar. Meaning, the
Mm-hmm.
end of the day, the minute you're able to develop this awareness, like you said, like, oh, every time my mother-in-law comes, my left shoulder hurts. Like, you've now developed an awareness. You've been able to connect. You've been able to connect the dots, and now you actually have the ability to do something about it. You have the tools to be able to do something about it. Because I like to say, which I'm sure you agree, is that I'm not fixing anybody. I'm giving you the tools to be able to fix yourself. And if you'll take these tools, you'll always be able to figure out what to do. And the minute you recognize something that you couldn't recognize before, you've already made a change in your brain. And you have to make that change in your brain to create a new permanent solution or a new permanent pattern. Where you might not have noticed something before, when you start to notice it now, well, if you notice it, you can make a change. And I think that's so important. So I think it's the same thing you're saying, maybe just said a little bit differently, but it's pretty much the same thing.
Yeah, no, thank you so much for saying that, because what we're trying to do, just like we would try to do with muscle memory, is we're trying to establish new circuits, new feedback loops. Why? So that we can kind of widen the parameters, so that we don't have to live so small, and so that we can have the ability to have more stress in our life without our body taking the brunt of it. And when you start breaking one by one these little loops that our body can get stuck in, then you can really start to make really big changes over time.
Well, that's great. I totally, totally agree with you. Okay, is there anything else that anybody may have asked that maybe we didn't talk about already, or that you could
Yeah,
think of?
I think we got a lot of them covered. Maybe you could go ahead with one of your questions. I'll look back here. I think those were
So
the big ones.
so I'll tell you what I think is important to talk about is the way that breathing helps us create better stability. because, every joint in the body needs stability. But if we don't have stability from our deepest center, then it doesn't really matter what's going on around the other joints. Because if you're not stable at the center, what was that expression that they taught us in PT school? You can't shoot a cannon from a canoe, right? Like
Hmm.
if you don't have stability at the center, how stable can anything else really be if we don't have that stability? And because I know it's breathing that helps create that stability, maybe we should just talk a little bit about how breathing helps impact stability as well.
Yeah, yeah. And, just thinking about the torso and your trunk and how it really takes up like a third of your body when we're talking about our hip flexors, our diaphragm, our pelvic floor and creating that center. And so just, again, going back to now we're looking at breathing from a physical therapist perspective of stability and of what this patient is going to present like orthopedically. I mean, we had this joke in PT school that if you can't figure out what's going on with a patient, look at their diaphragm. And it was a joke that has turned out to be true, right? So if you're not getting full contraction out of your diaphragm, look for problems in your shoulder, look for problems in your leg, look for problems in your knee, the way that when your foot hits the ground, like you said, it really is a matter of stability. And so now using this framework and understanding the core a little bit better and more functionally, we can make changes everywhere. And so this is why, like you said, every single person that walks through your clinic, they're learning how to breathe no matter what. And some people are going to be more curious about really getting that just to accomplish their goals. But yeah, I mean, I can see the same patient and do the best neck and joint mobilizations and the best fascial releases. But if their breathing and their core stabilization unit isn't working properly, I mean, I just feel so it's just going to come right back. It's just going to come
100%.
right back. Yeah.
So the way I like to describe it is that let's say I get a 16-year-old who broke their ankle. Well, we know that yes, you've got to make sure that the intrinsic muscles, the muscles of the foot and the muscles of the ankle are working well. But guess what? It's not as much about the ankle as it is what's going on higher. And that knee is going to sit on that ankle and that hip is going to sit on that knee. And guess what? That hip sits on the center of you. So if the center of you isn't stable, it's not that we're going to do the ankle and then we're going to do this and then we're going to do that and it's going to take a million weeks. It's that we're going to do it all at the same time. You're going to have to learn how to be stable from the center as well as get something for stabilizing the hip as well as down in the foot and the ankle as well. And so I'll tell you the way I describe it because like we said, this is a little bit of a back and forth. So, I'm not trying to usurp my guests today. We're really kind of doing this
Perfect.
together. But the way I explain it to people is that being able to diaphragmatically breathe, if you would picture a balloon, and often I'll use a balloon, but then sometimes I run out of them. But often I'll use a balloon. If you would picture a balloon, the diaphragm is the top of the balloon, and sitting inside the balloon is your whole digestive tract. And that is why people with a lot of digestive issues and anxious gut and all of that, very much affected by breathing as well, because your diaphragm is on the top, your pelvic floor is on the bottom. The deepest layer of the stomach will be the front, the deepest layer of the back will be the back. All of the muscles, there are multiple layers of stomach muscles and back muscles, and they're all important. They're just not as important in this breathing discussion as these muscles are. So we've got our balloon. Sitting inside that is the whole digestive tract. And good breathing or diaphragmatic breathing should look like this. When I breathe in, I push the top of the balloon. Well, I know if I push the top of a balloon because it's rubber, everything underneath is going to lengthen. Okay, so we know that's what happens when you push a balloon, and the breathing system is the same. So when I contract my diaphragm, and if you actually drew a line on that balloon, as funny as it sounds, you will see that if you push the top of the balloon, that line gets shorter because you are contracting your diaphragm when it moves downward. Everything below lengthens and moves away. But what you're also doing is you're massaging your digestive tract. So we'll get back to that again in a second. I hope you don't mind. I'm going to speak for a couple minutes just because this
Yeah,
is the way I like
perfect.
to explain it. So you
Yeah.
breathe in, Everything lengthens, you breathe out, it goes back. That is exactly the opposite of the way Helen spoke about in the beginning. Most people are often breathing from their neck, breathing from their back, and usually people will even tell you they think when they breathe in, their stomach should suck in. That is 100% the opposite of what they should be doing. So now, if I was to suck in my stomach, think about what would happen if I picked up a tube of toothpaste and I squeeze it from the middle. Stuff's shooting both ways, right? That is never going to feel good to your digestive tract, and we'll come back to the digestive tract in a second. So, in order to be stable, and this is where it sounds crazy, but when you do the exercises that Helen or I would give you, we're not going to go into this today. You actually have to learn how to create outward pressure and then how to contract from that outward pressure. That sounds crazy, but it works when you do it through the exercises after you've learned to breathe. Because, like Helen spoke about in the beginning, very often people are clenching those muscles so tight, their stomach, their tush, that you're never actually allowing those muscles to lengthen. We know that muscles get their strength from length, right? So I like to think of it like if I was going to shoot a rubber band, I've got to stretch that rubber band if I want it to have a powerful contraction to fly. So our muscles are the same. They have to be able to lengthen in order to be able to powerfully contract. So to be stable, we have to know how to lengthen and then contract from a place of length. I know that sounds crazy, but I promise you, if you do Helen's course or you come to me, everybody learns how to do it, whether you are 88, which is my oldest patient I think I've ever had, or whether you are 12, which is probably about the youngest I will ever see, because I personally only see people who could do their exercises on their own. Everybody learns to do it. You're just going to learn to do it in your own way. And backtracking, if you have pelvic floor problems, very, very often trying to do those Kegel exercises, like the people that tell you to do. Guess what? We just said the diaphragm, Helen said it a few times, diaphragm and pelvic floor have to work together. So how effective is it going to be to sit there doing Kegeling if we're not training the musculature to work together? That's why if you failed pelvic floor physical therapy, like a lot of my patients have, you actually have, if your pelvic floor physical therapist did not retrain your breathing, you're going to the wrong pelvic floor PT. Okay. And like we said, every time you breathe, you are massaging your digestive tract. So that's going to feel really good to people with stomach issues. And because 80% of your lymphatic system, Helen spoke about that at the beginning, is inside of your gut. The only way I can massage my lymph here and I can massage my lymph here in different places, not so easy to massage the lymph in my gut. But diaphragmatic breathing is one of the only ways to massage the 80, I think it's 80%, 70 or 80% of the lymphatic, your immune system that sits in your gut, which right, which rolls us back to why breathing will actually help you lower inflammation and improve digestion and improve your pelvic floor problem. It does everything good in the world, which Helen and I both know, and this is why we are so passionate about
So if
everybody
you're
how to breathe.
still with us, this is
Yes,
why Breathe to Heal is so
yes,
much more than just breathing. I mean, we are
yes.
talking about all systems. We are talking about inflammation, digestion, pain, sense of well-being. I mean, this really is, I mean, we think it's the best thing. We really do.
Okay,
I also have I have so many pelvic floor patients and patients that go through my program because they are just doing these exercises all the time and they're so compliant and they still have their prolapse. But thank you so much for giving us that visual with the balloon and understanding that it does have to work as a unit. So yeah, so important if anyone's been frustrated on that process.
okay, now she and I could talk about this all day, but I am trying to keep the podcast to close to an hour. And breathing, neshamah, nishima, there's so many good things that whoever my Torah person is going to talk about. So we're not going to go on with this. But one thing that I do think would be really interesting is if we each talk about like one or two recent interesting cases we had, maybe where you've seen breathing have tremendous changes.
What if it's okay with you, I would love to talk about how breathing has transformed some of my patients with chronic illness.
Yes.
And I'd like to tie it in because I know that we're catching ourselves if your listeners can't tell from not going overboard on the gut and on the organs and all of
Right.
these things. But when we just take it back to the beginning of the podcast, when we talk about how easy it is to be in this sympathetic dominance, chronic fight or flight, whatever term resonates with you, hypervigilance, we're talking about a lot of extra work on the lymphatic system and the liver. right? And so I think you and I can find a lot of pet peeves in the Instagram healing world, but and I've done detoxes myself. I do all the things, but when we're talking about trying to insert a healing method, and when you're still in this state, you cannot heal if you do not shift out of a chronic fight or flight state, right? And so, how this has helped my clients is that yes, we can do the brain rewiring work, but the actual physical sloshing of the organs, the organ massage that you get every single time you take a successful inhale, you're getting a liver massage. Okay. And so you're not only getting yourself out of sympathetic dominance, which closes that inflammation sink, but you're actually physically, manually pumping it out of your system. So I'm so glad that you continue to bring up the lymphatics in your gut, because I know a lot of people are struggling, are spending a lot of money and a lot of effort. I have a picture of one of my patients, and she sent me her countertop from a naturopath, and she's gone to all kinds of doctors. How many medications she's taking to heal her gut. And it's all good. Do the good stuff. But the good stuff, even the best stuff, is not going to work if the system that Dara described so well is not vibing, right? I actually, you gave me that toothpaste visual. I appreciate that so much. I've used that for a long time, because if every single time you breathe, you have that paradoxal movement that I described with the squeezing and bracing, you're squeezing down on your intestines. So here I am, Dara and Helen, they told you to breathe. And every single time you breathe, you are literally squeezing your intestines. Yes, not only is that going to give you anxiety, but I promise you are not absorbing the nutrients from the best of pills, from the best of diet, and all of those things. So I think that's why we are just so passionate, because it really just gets to so many underlying issues. And this is where I've had patients that have had maybe long haul COVID, even POTS, all of these things, all of a sudden, the good stuff that they have been asked to do finally start working, because their body shifts and is experiencing the world in a different way, in this more harmonious state of parasympathetic and sympathetic.
Okay, so I have a story, not about, I have a story because this is very recent and I just love this. And everybody loves a good soldier story because we're here in Israel. So I told you about this kid yesterday, Helen, but I got a new patient maybe about 3 months ago. He is in an elite combat unit. He's a lone soldier, and he came in with terrible back pain radiating down to his left leg. It really appeared to be discal, and he did have an MRI, and it was in fact a disc. Luckily for him, he wasn't in the advanced part of training where he was in his elite training yet. He was still with his elite unit, like his section was still, it was before they get their kumta, before they get their beret. And after they get the beret is when the elite unit is going to switch off. So he was only 3.5 months into his training. And of course, it turns out that even back before he got into the unit for over a year, he'd had some back pain. But when he came in, just trying to get him to breathe, he couldn't stop laughing. I'd never seen a reaction like this. Like trying to touch his diaphragm, just breathing, he would just crack up. And that was the first session. I would say that over about 2.5 or 3 months, he's probably had a total of 5 or 6 sessions. He doesn't get out of the army that often. He no longer has the pain in his leg at all anymore. He has just a little bit of back pain, but even that is getting much better. He's progressing every time we come. And I think that, please God, he should be able to continue on with his elite unit. But watching where he came from, watching this abnormal reaction just to breathing, he literally, I forgot about it. I just mentioned it to him. I think it was his 5th session this past Thursday. And I was like, remember the first 2 sets, you would hysterically laugh, and just seeing how much more at ease he is, how he's able. And sometimes I think people don't realize that what started out as a pattern of something that we did because we didn't have the ability, the awareness, or the muscle strength or the stability to hold a certain posture, eventually becomes habit. And now you just have to break the habit. So for example, if you would look at the way he stands, it was clear his core hadn't been working. His glutes weren't functioning. And now they are. But if you just look at him standing, he'll kind of stand in those old patterns. And it's just reminding him, no, you need to now put this. You need to stack your ribs on top of your pelvis. You'll feel your core kick in. You'll feel your glutes. You'll feel things kick in. But watching this kid, watching him progress, because Soldiers are my favorite patients. So, here in Israel, they're my favorite patients. I'm very passionate about helping them. So, watching the way he's progressed in only 5 sessions or so has been absolutely tremendous. So, that was my good story for the day. So, as you
A good
guys can
story.
see, thank you. Yeah. As you guys can see, this is something that Helen and I are both passionate about. We could go on and on and on and on, but I think you guys have gotten a really good taste and hopefully a decent understanding of why we are both so passionate about this and why it is the cornerstone of treatment for both of us. So now I want to flip myself a little sideways to ask the question that I like to ask all of my guests. Helen, what does spirituality mean to you?
That's a good question. Now I'm trying to think of what I answered the
I
first
should
time
have
I was here.
reminded you. Don't worry about what you
Yeah.
answered the first time.
Yeah, yeah. I think spirituality to me, and it's probably good because it probably changes all the time, but it's about being complete and whole in my body, so that I can be better outwardly. And part of being complete and whole in my body is letting go of fear and uncertainty and the lack of control that we have in some of these situations. And so for the spirituality, having, a greater source, that gives me that sense of, everything happens for a reason, that sense of security to alleviate the fears that I really can't control, right? Because there is so much that we can't. The little that we can, we do with breathing, but there's a whole lot that we can't. And so it's an active choice for me to strive on the path of, whether you want to call it parasympathetic, it's an active choice to follow bliss, to follow joy, to be a contributing member to my community. And that's, I think, what spirituality means to me right now.
I love it. I think that's
Yeah,
perfect. That is a perfect
yeah.
description. I love it so much. So tell me, where can people find you? And I'll link your course and I'll link your Instagram, but tell us, for anybody listening, where's the best places for people to find you?
The best place to follow me is on Instagram, and message me and communicate to me. And as you
Give
can
us your
tell,
Instagram handle.
that would be Dr. Helen at Brain Body DPT. So if you look up Brain Body DPT, I should come up as Dr. Helen there, and I am your PT bestie. And my goal in Instagram is to attempt to take these really scientific, cool ways of healing your body and giving it to you, just like me and Dara have in this PT bestie sitting on the couch type of content. So I'm really passionate about just empowering everybody about their own body and the incredible ability that it has to heal.
I love it. Thank you so, so much. I'll link your course. I'll link your Instagram and, anything else you want. And as always, this was a pleasure. I really enjoyed speaking to you. And I hope that you guys have gotten as much out of this as I got out of it because I could talk about this stuff all day long. I love it. I love it.
Thank you
But
so much for having me again.
when I talk about it on Instagram, no one wants to listen to me. They only want to hear me rant about Israel. So like
We need that too. But
yeah,
see, that
exactly.
that calms my nervous system, right? We're all looking for safety and support, and this is, you give us so many gifts.
Thank you so much. This has been an absolute pleasure. Thank you so much. Hey everyone, I am both super excited and slightly disappointed. You guys are going to get not one, but two Torah extras today. And there is, even with two people speaking to you guys today, there is so much more the Torah has to say about breathing. And we thought we could all be on together, but you guys will probably notice I'm not in my usual closet house. I'm actually in my office because my daughter's wedding is, God willing, this Thursday. Bezrat Hashem, the podcast will be coming that day. And I don't have a dress yet because my first one didn't work out. So I had to run after this to Petah Tikva, so it was easier to record from here. So first up, we are going to have Nomi Levy, my good friend. You guys have heard her before on this podcast. And Nomi, and look how gorgeous she looks because she's on her way to a wedding. I
I'm on my way
drove,
to her.
yeah, and I drove both Nomi and Liora crazy about the timing, and now we can't even do it together. But it doesn't matter. It's all gonna be good.
Meant to
Everybody
be.
knows, yeah, this is my passion project. I can't wait for this episode to come out. So Nomi, hit me up with what do you have?
Well, first of all, I love that this whole podcast is your passion project, but really your passion project is breathing.
This true.
That is your passion project since the first day that I've met you. Even my kids, when I send them to you for PT, know how important breathing is. And I love that they're hearing that from somebody other than me. And so today, when I looked into the Torah portion, and it's a great Torah portion for this week, it's Vayetze, and how to connect that to breathing. So when we think of Vayetze, it's actually the most prominent thing that stood out to me is this is the Torah portion where Yaakov ascends the ladder. And so when we look into that ascension of the ladder, and there's a lot of other things that happened in this parsha, by the way, but this to me is the most interesting because really what Yaakov ascending the ladder means, and I saw this from a few sources, from Breslov, from Chabad, is this idea of Yaakov actually going up, having this spiritual journey. And that's something that we all have, right? A spiritual journey. What is a spiritual journey? A spiritual journey is a journey of the neshamah. And all the time I remember, like when I was becoming from, there was this question that always popped into my head was, are you a guf or a neshama? Like, is what you're doing aligning with what your neshama wants or what your guf wants? And I think that's such a great thing to teach our kids to think about ourselves, especially in this day and age when we're always so pulled in many directions. And so when we think about spiritual ascension and we think about the journey, the spiritual journey, it's really the journey of the neshama. And neshama is also another word for breath, right? And so we know really that this idea of going on our spiritual journey, we have to really be so present with ourselves because when I think of, well, how do I bring breath into my daily life? It's actually really being present. It is so often on a regular basis that I just forget to breathe. It's that simple. Like I'm breathing into my chest. And I was thinking about this idea forgetting to breathe, forgetting to take deep breaths, forgetting to be present with my breath. And how many times am I also just kind of forgetting to be present with my own spiritual journey? And so when I think about this parsha and I think about really tying it to breath, which is so basic, right? It's before everything else. It's the first thing that we do. It's the first thing we do. We come out of the womb, we take a breath. It's the last thing we do. And it's also this idea of like really being present with our breath, with our neshama, with our spiritual journey, and tying that all together through our life and just taking enough time to slow down and pause and be with that journey and be with your breath and really be present with yourself.
I love that. Thank you so much. Yes, it's one of those things I've done posts on, right? Like when a baby is born, the first thing they do is they take a neshama. And the last thing that happens is you take a breath and your neshama leaves your body at the end of your life. It is, it's so powerful. You got me. You understand me. And that was so beautiful. Thank you so, so much. I really appreciate it.
Thank you. Can't wait to dance at the wedding.
Me too. Yes. I can't wait to see it. By the time this comes out, it'll be almost time.
Awesome.
Thank you so much, Nomi.
Thank you.
Okay, we are up. Here we go. So, guys, we're back here with Liora Rosenblatt. I really appreciate this. You guys have met Nomi before. I've known Nomi for many years. This is Liora and my first time getting together. We met on Instagram. I love what she's doing, and you're going to hear a little bit about that, and you'll have heard a little bit about that in the intro, and there will be links for you guys to check out her organization, Sophia. And I've kind of driven her crazy. For someone who didn't know me, we changed the date, we changed the time, we tried to all make it happen together, but like I said in the first part, unfortunately Riverside was not cooperating today. I'll have to figure out why, and we're doing it separately, but we'll put it all together into something I know spectacular for you guys. So Liora, welcome. Thank you so much.
Thank you so much for having me, Dara. I'm really honored to be here. So as Dara said, just very briefly, I'm Liora Rosenblatt, and I run a website called sophia.org, which essentially carries deep and authentic Torah content for women that is relevant to their daily lives. And today I want to talk to you about breathing and the Torah sources, I should say, for breathing, and what does the Torah say at large about this concept. So I want to start off by saying that, breathing, meditation, mindfulness are, they've become increasingly fashionable today. Modern psychology emphasizes the importance of this practice, but as we know, Torah is always the first on so many levels, and it mentions its significance since the beginning of times. So the first thing that I want to mention is the book of Bereshit. So Bereshit discusses on the 6th day of creation, the creation of men, of Adam. So just to be very specific, it's in the 7th chapter and the 2nd verse. I'm going to read a pasuk in Hebrew and then I'm going to translate it. So it says, Vayitzer Hashem Elokim et ha'adam, afar min ha'adama, ve'yipach be'apiv nishmat chaim, ve'yeh adam lenefesh chaya. So it means Hashem formed Adam from the dust of the earth. He blew into its nostrils the breath of life, and Adam became a living being. So I want to just go back to 2 words here, nishmat chaim. So I want to focus on the word nishmat here, and that is the word for breath, nishmat. But it's also neshamah, because nishmat is basically in Hebrew, if you know grammar, it's called smichut. So when there are 2 nouns next to each other, the last letter of the word changes. So here, nishmat, neshamah, they're basically the same thing. So it's fascinating here because breathing is a physical concept, but evidently it's also a spiritual concept. So Hashem blew into Adam's nostrils this breath of life, this neshamah. So when we breathe, it's something physical, but it's something so inherently spiritual as well. So we see this interconnection between spirituality and physicality right here in this pasuk in Bereshit. So breathing on a deeper level really represents our connection to ourselves, our connection to Hashem because we are a part of Him, and just a connection to life in general. I want to now talk about the busy lives that we live, just these frantic lives that we live, very similar to slavery in Mitzrayim, in Egypt, that Paro made us work endlessly, and even demanded that we make our own straw and cement, just, things that are like crazy to think about, and just with the goal of keeping us busy, all the time busy, all the time busy. And today, when we think about it, our lives, our responsibilities, our multiple email accounts, they're all there to keep us busy, but what's the purpose? Like, we need to pause and breathe. Like, where am I going? So in fact, the Torah literally says in Shemot 6:9, so chapter 6, verse 9, that we were ketzar ruach, short of breath during Egyptian slavery. We didn't have time to breathe. So Rashi here explains something which therapists and coaches today talk about nonstop. We're talking about, when our breaths are short, they're rapid, they're shallow, which is called hyperventilating. But when we are calm and in touch with ourselves, our breaths are deep and long. And this has an impact on our nervous system. It has an impact on our entire being. So if we want to really pause and live properly, quote unquote, we need to schedule time to breathe on a daily basis. Now, I want to talk about the flip side of breathing, because until now we spoke about how breathing is, linked to connection to ourselves, to Hashem, to life, but it also has a downside. And the downside, the negative connotation of breathing, can be found in the story of Evel and Cain, and also in the book of Koheles, because Koheles says Hevel Havalim, which is translated as like the futility of futilities, but actually it means vapor. Okay, so Evel is a type of breath that is devoid of life and potential. Evel means nothingness. It means a vapor. It means that there's nothing behind it. And that is basically the association of breathing that teaches us that life is short and temporary. if we look at the character of Evel himself, brother of Cain, he was a man who was incapable of thinking, his own thoughts, of being a critical thinker. He was just mimicking his brother's actions, and this cost him his life. And Rabbi Sachs actually says that this is the proper translation of Evel, is like, it's short. So we live with this duality. On the one hand, we have the nishmat, we have life, we have this eternal soul, but on the other hand, we have Evel, we have this, shortness, the fact that our lives are temporary. So we have to live with this duality, and we essentially have to make a choice. What kind of breathing are we practicing? What kind of life are we involved in? Do we want to be connected constantly to Hashem, to eternity? Or do we want to be like in Mitzrayim, like constantly just huffing and puffing and just not breathing properly and be this Evel Avalim? So really the power of breathing, just to conclude, is this incredible gift of knowing how to be connected to yourself, of knowing how to have this awareness to Hashem, to our Creator, to ourselves, and to our fellow creations. And so I want to talk, to Jewish women at large. Like, this is a choice that you make daily. And I hope that B'ezrat Hashem, we make this choice very wisely, and that we choose the breathing of life and not the breathing of Evel.
Wow. That was really, really great, because it's true. What are people doing when they're not breathing well? Most people who come into me, they're not breathing well. And that would be like the breathing it's not going to get you anywhere. That's not allowing you to pause. That's giving you anxiety, and it's not giving you, this ability to regulate and deregulate your nervous system. And also, when you talked about in Egypt how Paro gave us things to do just so you were busy all the time, it's sort of the way I think a lot of women are when they're young. And we have a lot of people. We've done a few different episodes on menopause and hormone replacement, and a lot of people. I will say it is probably more women than men listening to this podcast. But a lot of them are in this you're not in this age, but a lot of them are in this like over 40 age where they're getting into perimenopause, menopause, and things like that. And to me, that's kind of a time where people are finally willing to stop and say, wait a minute, no, I'm not going to do 900 things. Like, we finally learned to stop and like say no and breathe for a minute and realize like we can't do everything, because you do everything, you don't do anything well, and you run yourself ragged. And so to me, that sort of ties in just with this whole age that so many of, the listeners are, and so many of the things that we've talked about, and this learning how to, take a breath and pause and realize what are the most important things, and that I can't do everything. And I'm going to say no to things.
Exactly. I kind of want to, what you're saying is so true. I want to kind of just respond. We have this misconception that just being busy is good. It is good to be busy, but not constantly overdoing it. Having this balance of being busy and taking time for ourselves to breathe, to know who we are and where we're going, is essentially, I think, the right balance that Hashem wants from us. So yeah, that's good to keep in mind.
I fully agree. Well, I just want to thank you so much, and I hope this will be just the first time that we hear from you, because this was great. Thank you so much.
Thank you so much. I'm looking forward to joining again, and thank you for the opportunity.
Absolutely. This podcast is for informational purposes only. Please seek guidance from a trusted healthcare professional. By listening to this podcast, you release Holy Health and all of its guests from all liability. I'd like to thank Yakir Abelo for editing this podcast.